Hi, my name is Elison Cabrera, and I'm going to talk about emphysematous cystitis. Definition. Emphysematous cystitis is a rare entity characterized by pockets of gas in and around the bladder wall produced by bacterial or fungal fermentation. The presentation may be typical, and contrary to the degree of inflammation, patients may present with subtle clinical findings. Patients may complain of irritative symptoms, abdominal discomfort prematurely.
Cystitis is a condition which results in constant urge to urinate and a burning sensation during urination. There is also pain in the lower abdomen and back. The urine passed by the patient is thick, dark in color, and has a pungent smell. Sometimes, the patient may pass blood or pus in the urine. Any infection in the urinary tract can lead to cystitis. Going for long stretches of time without urination leads to irritation in the bladder and can also cause this condition. Severe constipation, kidney or bladder stones, or enlargement of the prostate gland may also result in cystitis.
Application in medicine. 72 years old with poorly controlled hyperlipidemia and diabetes presented to the emergency department with a 5-day history of lower nausea and vomiting. Physical examination revealed lower abdominal tendons. Blood tests revealed leukocytosis associated with a left shift and elevation of levels of C-reactive protein and glucose. Pros and cons. Pros. The radiographic findings provided the first and only diagnosed clue. Abdominal pelvic CT scan can further delineate the extent of disease. Cons. Emphysematous cystitis requires aggressive treatment with parenteral antibiotics and bladder drainage.
Now patient in left retral decubitus posterior is carrying in subcostal vein. This is the portal vein of the patient. This is the common viaduct. And the portal vein is patent. Common viaduct is not dilated. Measures 5.4 millimeters, normally that is 7. And here you see that there is a calculus impacted in the neck of the gallbladder. In this area, this is the calculus weighing 14 millimeters. This is the gallbladder, the longitudinal section. This is the liver. This is the portal vein.
Issue applied in Ecuador. Emphysematous cystitis is a urinary tract infection that is associated with gas formation and is commonly caused by Escherichia coli and Klebsiella pneumoniae. The disease is often associated with female sex, immunocompromised state, diabetes mellitus, previous recurrent urinary tract infections, urinary stasis, neurogenic bladder, and in transplant recipients.
In our discussion of urinary tract infections, we turn to cystitis. To define it, we call it a clinical syndrome characterized by dysuria, frequency, urgency, and occasionally suprapubic tenderness caused by inflammation and infection of the bladder. It's a disease that's much more common in women than men. In fact, Women have an incidence of asymptomatic bacteriuria of around 1 to 3%. Up to 60% of women have had at least one episode of cystitis during their lifetime, and 10% have it once a year. The peak incidence is among young sexually active women 18 to 24 years of age, and 2 to 5% have recurrent problems with cystitis.
Conclusion. The patient was treated with broad-spectrum antimicrobial agents and placed in a poly catheter. Subsequently, a urinary culture was positive for Escherichia coli. The patient was treated with antibiotics and recovered eventually.
E. coli are a large and diverse group of bacteria. Although most strains of E. coli are harmless, others can make people sick. Some kinds of E. coli can cause diarrhea, while others cause urinary tract infections, respiratory illness and pneumonia, and other illnesses. Still, other kinds of E. coli are used as markers for water contamination. Some kinds of E. coli cause disease by making a toxin called Shiga toxin. The bacteria that make these toxins are called Shiga toxin-producing E. coli, or STEC for short. The most commonly identified of these in North America is E. coli 0157H7. When you hear news reports about outbreaks of E. coli infections, they are usually talking about E. coli 0157. In addition to E. coli 0157, many other kinds can cause disease. People of any age can become infected. Very young children and the elderly are more likely to develop severe illness than others, but even healthy older children and young adults can become seriously ill. The symptoms of these infections